Namaste, my name is Dr. Lakshman. I am a consultant surgeon at JAYADEV Memorial Rashtrotthana Hospital and Research Center. I thought I would share some basic facts about a groin hernia with you. A hernia is a lump that one feels in the groin, either on one or both sides. Basically, a hernia is a protrusion of a part of the contents of the abdomen, commonly referred to as the stomach, through a defect or a hole in the abdominal muscles. What happens is that the musculature develops a little hole in the groin area, and the fat inside the abdomen, called the omentum, or the intestines, may come out of the hole, forming a lump. The characteristic of this lump is that it comes and goes. It is there many times when you stand and walk, and most of the time it disappears when you lie down. This is a classic feature of a hernia. Many times it is painless, but if it starts giving you any pain or discomfort, this is a danger symptom that you must be aware of. It is good to contact a surgeon when you have a lump, but when you have a pain in the lump, it is mandatory that you have an urgent consultation with a surgeon. The surgeon will examine you. Most of the time he will elicit what's called a cough impulse, where he asks you to cough, and when that happens, you will find that the swelling becomes more prominent, and he may then elicit what is called reducibility, where he pushes the lump back and the lump goes away. These two are classic features of a hernia. A hernia is a surgical condition. Please note that medicines and exercises and physiotherapy and the like will not solve the problem. A hernia has to be dealt with by surgery. At surgery, what is done is that hole is defined, the hole in the muscle that I spoke to you about, that is defined and is usually closed with a mesh. A mesh is a synthetic material, usually a material called polypropylene, which is a sieve-like sheet, and that sheet will be fixed in place either with metal pins or with sutures to close the hole. Why should hernia be operated on? The simple answer is that hernia can potentially give rise to sometimes life-threatening complications. This is not meant to scare you or make you unnecessarily apprehensive, but to bring home the fact to you that hernia is a lump that should not be ignored. What happens is that this intestine that is inside the abdomen comes out through the hernia, and if it keeps going back, there is no problem. But at times it comes out and gets stuck there. When that happens, it leads initially to a blockage of the intestine, which gives rise to severe abdominal pain and vomiting and sometimes bloating of the abdomen. When the process continues and the blockage becomes more and more severe, it may even end up compromising the blood supply to the intestine that has come out and got stuck. When the blood supply is compromised, then that part of the intestine may die, a process called gangrene of the bowel. This is potentially life-threatening, and it is important that we deal with the hernia well before the obstruction or the gangrene supervenes. The preparation for surgery is fairly simple. Routine blood tests like blood counts, kidney function tests are asked for. It is customary to get an ultrasound also of the abdomen done. What ultrasound can show is perhaps a small hernia which may not be clinically detected on the other side also. Also, it is important that we establish that you are emptying your bladder well, because hernias occur very commonly in the elderly, and they may have an associated problem with the prostate gland, which prevents them from emptying their bladder well. If indeed they have a problem with the functioning of the bladder, one of the consequences that may occur is a blockage of urine after repair of a hernia. So it is better for the surgeon and the patient to be forewarned about this. Hence, an ultrasound examination is done. Operations can be either by the open method or by the minimally invasive laparoscopic method. The principle of what is done is the same. As mentioned earlier, we define the defect or the hole in the muscle and block it, close it with a mesh. A laparoscopy is now considered a better procedure because of less pain and quicker recovery, even though it should be said that the large majority of hernia operations in the world, even today, is done by the open method. It is a safe operation. Complications are extremely rare, but one should be aware that these rare complications can and do occur. One of the phenomena is that however well the operation is done, in 2% of cases it can recur. The mesh that we put and fix in place can shift, and so patients may end up with a recurrence of a hernia or the lump, and this may usually occur within the first 2 years after surgery. 80% of recurrences occur in the first 2 years after surgery. Other rare complications include infection, bleeding, and the like, but I would like to reiterate and stress the fact that the complications of not dealing with the hernia with surgery are a lot more serious and a lot more common than the complications of the hernia operation. So one should not be afraid of the operation. One should go ahead and make a prompt decision to get the surgery done and go ahead with the surgery, so that the other serious complications of an unattended hernia can be avoided. I hope that this gives you some basic information about hernia and the involved surgery. If you have any questions about it, please feel free to contact the personnel at the hospital, and we'll be happy to answer those queries for you. Thank you very much.
ರಾಷ್ಟ್ರೋತ್ಥಾನ ಆಸ್ಪತ್ರೆಯು 160 ಹಾಸಿಗೆಗಳ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಯ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಅಂದರೆ ಒಂದೇ ಸೂರಿನಡಿ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿ, ಆಯುರ್ವೇದ, ಹೋಮಿಯೋಪತಿ, ಯೋಗ ಮತ್ತು ಪ್ರಕೃತಿ ಚಿಕಿತ್ಸೆಗಳನ್ನೊಳಗೊಂಡ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಗಳು ಇಲ್ಲಿ ಲಭ್ಯವಿವೆ. ಅತ್ಯಾಧುನಿಕ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ, ಉತ್ತಮ ತಂತ್ರಜ್ಞಾನ, ತಜ್ಞ ವೈದ್ಯರು ಹಾಗೂ ಇತರ ವೈದ್ಯಕೀಯ ಸಿಬ್ಬಂದಿಗಳನ್ನು ಈ ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. 19 ಜನರಲ್ ವಾರ್ಡ್ಗಳು, 72 ಸೆಮಿ ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳು, 11 ಎಮರ್ಜೆನ್ಸಿ ವಾರ್ಡ್ಗಳು ಹಾಗೂ 17 ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳಿಂದ ಕೂಡಿದ ಸಮಗ್ರ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ ಇಲ್ಲಿ ಲಭ್ಯವಿದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಬಡ ರೋಗಿಗಳ ಬೆಂಬಲಕ್ಕಾಗಿ ದಾನಿಗಳ ಸಹಾಯದಿಂದ ನಿಧಿಯೊಂದನ್ನು ಸ್ಥಾಪಿಸುವ ಗುರಿಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಜೊತೆಗೆ ಹತ್ತಿರದ ಸ್ಲಂಗಳಿಗೆ ಹಾಗೂ ಹಳ್ಳಿಗಳಿಗೆ ಹೋಗಿ ಉಚಿತ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುವ ಯೋಜನೆಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಅರಸಿ ಬಂದವರಿಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಆರೈಕೆ ನೀಡುವುದು ಮತ್ತು ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ಚಿಕಿತ್ಸೆ ನೀಡುವುದು ಆಸ್ಪತ್ರೆಯ ಆಶಯ. ಎಲ್ಲರೂ ರೋಗಗಳಿಂದ ಮುಕ್ತವಾಗಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜ ನಿರ್ಮಾಣವಾಗಲಿ ಎನ್ನುವುದು ಆಸ್ಪತ್ರೆಯ ಉನ್ನತ ದೃಷ್ಟಿಕೋನ.